More than 1 billion people around the world smoke, even though most of us know that it can kill us. In fact, half of all smokers will die from their habit. We travel to Uruguay, a small country that's taking big steps to stop the epidemic. A typical Friday night in downtown Montevideo, Uruguay's capital city. In this Latin American country, tango is part of the culture. So was smoking until recently. In a move that set a precedent for the continent and for much of the rest of the world, in 2006, smoking was banned in every enclosed public space in Uruguay, from galleries to restaurants and offices. Smokers found themselves literally on the outside. We came here to Uruguay to see how the anti-smoking campaign is working.
Along with Argentina and Chile, this country consumes the highest number of cigarettes in the American continent.
Dr. Laura Roballo is a heart specialist and a member of CIET, Uruguay's Center for Investigation into the Tobacco Epidemic.
In our country, smoking is the primary cause of preventable death.
Uruguay now has some of the strictest anti-smoking laws in the world, and it's the first country in Latin America to impose such a stringent ban on smoking in public places. Experts say it's a model for others to follow. And there's more. Getting the message out on the health dangers to smokers came next. And in this macho culture, there were no holds barred.
More man or less.
This aggressive government-funded information campaign was aimed at counterbalancing the slick publicity from tobacco companies who feared the erosion of one of their most lucrative markets in the region.
Smoking used to be seen as very distinguished because the images of smokers here were always associated with youth, sport, glamour.
Selba Andrioli is director of the advertising company responsible for the anti-smoking campaign.
Women, in particular, would do it for the charm that smoking gave them.
And it's not just the women in Uruguay, it's worldwide. Targeting women specifically, the World Health Organization released this video on World No Smoking Day in 2008. Aiming to subvert the perception that smokers are sexy. The woman rejects her would-be suitor because he stinks of cigarette smoke. The message is clear. It's not glamorous to smoke. In late 2008, the Uruguayan government opened a new front in the battle against smoking. It's the total banning of any cigarette advertising in all media, in sponsorship of artistic and sporting events, and on the street. But advertising hasn't gone away. Although the brand names must now be out of sight, it seems that doesn't necessarily mean out of mind. With so much at stake, cigarette companies have found a way to keep their product visible on the streets of Montevideo without breaking any laws.
The intelligence, the ingenuity that they are using in their own street advertising nowadays, which is totally prohibited by law, is excellent.
Eduardo Dreyfus is an anti-smoking activist and a member of CIET. He says tobacco companies continue to advertise their products on the streets subliminally.
It's interesting to see how the colors and the design in the billboards that we found today are immediately identifiable with the adverts that used to be used on the street, especially on the kiosks. You see this type of design and you immediately make the association as though you were seeing the brand name.
Carmela runs this kiosk selling Nevada cigarettes, the most popular brand in Uruguay.
It doesn't say Nevada anywhere, but people aren't stupid. We work in conjunction with the tobacco company. In some cases, they pay the electricity, in others, the upkeep of the kiosk. And it's not just because we sell their cigarettes, it's because we are their publicity.
A lawyer for Monte Paz, the Uruguayan company that produces Nevada cigarettes, declined our offer to comment.
To advance effectively in the fight against tobacco, the best path is not that of confrontation.
Tabare Vasquez is one of Uruguay's top cancer specialists.
The best way to move forward is through persuasion.
And he's in a unique position to persuade people. He's not just an oncologist, he also happens to be Uruguay's president and the driving force behind the anti-smoking campaign. Persuasion, he believes, means not only stressing the grave health risks, but also providing free and universal treatment for all those who want to quit smoking.
At first, it seemed that we were on a mission impossible. But now there's been a noticeable reduction in the consumption of cigarettes.
And catching potential smokers before they start is also high on his country's priorities.
What do you recognize?
Poison.
This is rat poison, right?
Window cleaner.
So the person who smokes is going to take in all these substances.
But how many other countries have taken strict measures to protect their populations from smoking-related dangers? The World Health Organization estimates that only 5% of the world's population is protected by the kind of comprehensive legislation that they have in Uruguay. And the developing world is lagging dangerously behind. The tobacco industry, many experts believe, has been quick to pounce on the opportunity to market its product in countries still free from restrictions or where existing bans are seldom enforced.
So what we are seeing now is that smoking is going down in developed countries, but is on the increase in developing countries.
Dr. Mirta Roses is director of the Pan American Health Organization.
We have noticed that where policies of tobacco control are being introduced in line with the World Tobacco Convention, then there's a reduction in the number of smokers.
The World Health Organization's Global Tobacco Convention requires governments to enforce anti-smoking legislation. To date, 164 countries have signed. In Uruguay, the number of smokers has dropped from 1/3 of the population to less than 1/4.
¿Le preguntaste si quería fumar?
Did you ask him if he wants to smoke?
But unless more countries follow Uruguay's example, millions of adults and children, the next generation included, could die from a tobacco-related disease.